Welcome to Behavioral Health in the New Normal, a podcast developed by Prestige Community Resources, aimed at bringing healing back to our community through knowledge, expert advice, and positive messaging. The show is a joint venture between the Department of Behavioral Health and Prestige Community Resources, funded by SAMHSA in response to the challenges currently impacting our communities. Hosted by Paul Wells Sr., who uses over 30 years of extensive clinical social work experience to conduct insightful interviews with experts and professionals on a wide range of topics that impact the Washington, D.C. community. From behavioral health crisis to education to financial hardship and anything in between. This show will provide information and insights that will surely make a difference in your life.
Welcome back, family, to the podcast series offered by Prestige Community Resources in conjunction with the Department of Behavioral Health. I'm excited today because we have an extraordinary guest that's going to navigate us through the perils, challenges, and opportunities that are presented by the COVID-19 as it relates to homelessness. And I have an expert in terms of service provision when it comes to the state of homelessness. Let me introduce you to Mr. Alfonso Padron. Mr. Padron, how are you, sir?
Thank you. Thank you so much, Paul. And I'm humbled by that warm presentation in regards to, what I do. I certainly do appreciate that and with gratitude.
And let me say this, we're grateful to have you on our show to help us understand the impact COVID-19 has had on the state of homelessness and the service delivery. Today, we're going to really talk about how the COVID-19 has slammed the homeless population, and we're going to share new struggles that we are facing due to the pandemic, and we're going to provide information of available resources to help combat the increase in homelessness. So I think it would be appropriate, Brother Alfonso, if you could just share a little bit, how did you get into this work? And let's start at the beginning. Where were you born? Where were you raised? And how did that influence your decision to work in this field?
It's interesting that we start off this way and you ask me that question and it just brings me right back to when it all started. I was born and raised in New York City, Brooklyn, New York, of course. Parents remained together for a certain length of time, but I'm a product of what has become to seem like a norm. So my dad was secretly, abusing of my mother secretly. One moment there'd be a moment that she'll be fine. Next moment there's scars on the face. So domestic violence was a part of my growing up. Being evicted from apartments was a part of growing up. The suffering and the drug use at that time when I was growing up was a part of my environment. And so that's what makes me so effective in what I do. And then without realizing, I would literally wind up getting into the business of actually trying to house the homeless. Because I am the product of the very people of the people that we serve.
Yes.
I was once homeless myself too,
Okay.
as a United States Army veteran and so on,
Yeah.
During that time, it was simpler for me because we didn't have the pandemic. So I was able to lift myself up out of that scenario, whether it was drug use, whether it was those transitional housings, whether it was those rehabilitation programs, and also incarceration. So, I didn't leave any of that out. Those were the part of my experiences that I brought to the table or contribute to the community of whatever ward here in DC that makes me so effective. Why? Because I've been in the trenches with those involved and those that are experiencing the same things that I've experienced. And so that's what brought me here.
And I'm sure your experience and journey, your life journey, has equipped you with added sensitivity and insights that are very useful in your daily work. You
That's
know
right.
you know the experience firsthand, and most importantly, you've had the experience of recovering and empowering and moving forward in spite of the experience. You didn't stay stuck, as they say. And
Right.
so I'm sure your testimony, although you don't broadcast it, I'm sure, to your clients all the time, gives you a radar and a navigation system that some people in the field may not have. And so you said something that was real significant, and you said that the journey through an experience with homelessness outside of the pandemic is very different than now that we're in a pandemic. What are some of the differences and unique struggles if you're homeless right at this current time?
Now, here's the interesting part in that question. When you find out that there's someone homeless outside of the norm, your children has or your child has been put on the street. They're doubling up. They're
Mm,
couch surfing, even though they're not considered homeless.
right,
But
right,
they're out there struggling to just figure it out. When they started realizing that we have a homeless population that needs attention, they were preparing to provide places where folks can lay their heads, where they could find a safe place, where they could find tutoring, where they could find shelter, where they could find food, clothing, so that they could rehabilitate their minds with, and that's before the drug use, because now they to deal with that situation, they self-medicate.
right,
And
right.
so they started recognizing that, you know, this was a problem. They were first dealing with the drug episode. So people were just now drinking and drugging
That's
and
right.
and going through the process of experience homelessness. And
Mm,
so when they decided, okay, one thing is being taken care of, that's when they decided we're going to go ahead and jump on the other. But what they didn't prepare for was a pandemic like this
yeah,
that took place, because now everything had to stop and they had to reinvent their whole process.
you're
Now
right.
it's leaving our homeless, our youth, and now the weather's also adding to it. It's affecting how their resources are now limited. It affects how it creates obstacles for them, that is just becoming a
Oh,
pandemic.
right, pandemic, absolutely. So you said something interesting, and that is not only has the pandemic created a mental shift in terms of the mind of the person who is homeless, but the resources also shifted. That now, as a result, there's limited access. Not only is there limited access, the resources aren't even available in some cases because of staffing shortages, resource dilemmas, uh, and so it, being able to access services has been aggravated as a result of the pandemic. So I would imagine that if I'm in a state of homelessness, not only am I anxious about being out on the streets and being vulnerable to the virus, but my sense of homelessness is probably enhanced because the possibility of getting stable or temporary housing has been reduced.
And dramatically.
Yeah,
So
yeah,
there's another pandemic within the pandemic. So
yeah.
now we have a crisis that's doubled or quadrupled in increases. And then, like you said, limited resources, limited space. Oh, but wait a minute. Now we have to social distance.
That's right.
Now
That's
we
right.
have crowded facilities where now we have people enforcing the rules of this crisis, and we had to adhere to the health codes. Now there's fights between staff and those that we're trying to service, who have mental health issues behind the whole pandemic. And so it causes even an increase of more issues that we're left to have to deal with.
You know, some of the
Absolutely.
basic safety protocols that we have to adhere to, like wearing a mask, washing your hands, maintaining social distance. Um, what 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 options, if I'm on the streets homeless, uh, what options do I have in terms of keeping a clean mask and having sanitizer and just the basic safety protocols. Is that challenging for the homeless population at this time?
Yes, it is. And it's a very good question because guess what, Paul? It's unavailable.
Wow.
There is no, you know how you could take your vehicle and just make a stop and say, I want to wash my car.
Hmm.
There's no drop centers, enough drop centers like that for a
Okay.
homeless person to be able to do that. I could give you a brief story, okay, based on one homeless person being out there in the elements for months on end. I mean, smelling so bad that he just can, is so unbearable that he decided himself, I'm going to call my family members. I'm going to at least reach out to them. I haven't seen them in years, but at least I need a hot bath, cup of soup, and I'm out the door. Well, guess what? When that person decided of, and then the parent was of age, of course. When that person decided to make that decision, I'm gonna call home and get close to mom or grandma. When they walked in, with the rags that they had on, layers upon layers,
Right.
that's been collecting the dust from the ground, from the air, everything that's every particle on their clothing,
Hmm.
caused the mother to get infected, catch the COVID-19, and she passed away.
Oh my goodness. Right. So yeah, you said that the mother contracted the virus
Office
from
closed. Hmm.
office clothes. Yeah. So that's interesting because the state of homelessness increases the risk of contracting the disease. It also increases the risk for those who work with that person, the family, the workers. Have you been more aware of your safety and taking preventive measures when you work directly with persons who are homeless?
You know what? That's an even greater question now. With that, it's been a normal practice in the religion and my beliefs that I have. We're constantly keeping ourselves cleansed and
Hmm.
purified. And so
Yes.
kapow, the connection was made. Like here it is now. We're all finding out how important it is to keep yourself cleansed. And
Right.
so I find myself more conscious, more conscious, twice the amount, because I know the population I'm dealing with. I mean, I
Right.
could literally, if I had a face to face right now with one of our clients, he's just now coming off the street. Your senses become heightened and they become sensitive. And all of a sudden, even if you do have a mask on, all of a sudden you're starting to cough
Yep.
because something off his clothes is now viral. And so you realize that okay, this is literally happening. This is real. This is what's really happening. And I gotta continue to combat my,
Yeah.
protect myself and combat this whole issue that we
Absolutely.
have because it's
Absolutely.
not to be ignored. So
You
it's
know,
a great
behavioral
question.
health providers have uh, transitioned into telemedicine format as the primary engagement platform. Um, and we know that the providers such as you and I are relying more heavily on telemedicine. I was just thinking though that this could be a real barrier for our homeless population because they don't have access to Zoom and computers and cell phones. And so I would imagine that more than other categories of need, that when you're working with homeless folks, there's a little more requirement on you to do face to face. They don't have access to technology. Has that been your experience?
Yes. And there's
Wow.
also another barrier and another obstacle because now here we're becoming separated from those who need us,
Right.
who are facing the challenges already and the obstacles that they're unable to go and get a simple ID based on
Yeah.
this alone. And so they are now becoming almost non-existent. So
Look at that.
how do we connect with how do we connect with them? Do we show up in one of those those biotech masks and everything with the booties and everything,
Exactly.
just to
Exactly.
deal with them? That's the concern. Our
Yes.
this pandemic is going to change the way our economics is going to be run in the next couple of years, and we're sacrificing a very large population.
Yeah. The homeless population, in some regards, those suffering in the state of homelessness are invisible already just by their
Yes.
condition and state. Now, when you add the pandemic and the lack of interaction that they have or opportunities with interaction, now they're completely invisible. And so I'm glad you kind of alerted us to that. Something else you said that is so true, and my take on it is not everyone can work with persons who have suffered with a state of homelessness. You talked about their presentation is sometimes undesirable as a result of their lifestyle. Like you said, the grooming and hygiene may be poor. Their mental health may be very disheveled. There might be increased agitation. I guess what I'm saying is sometimes they're difficult to be around just based on their presentation. And not everyone in the behavioral health field has the tolerance or the acceptance or the ability to work past that presenting, those presenting factors, right? The agitation, the bad body odor, the disheveled presentation. It takes a very special person to be able to almost ignore that or incorporate all of that into their engagement. So I salute you because when we talk about frontline workers, you're a frontline worker. You're in the trenches, and the trenches aren't always a pleasant place to dwell during your workday. It's tough. It's tough territory. It's like going into combat. You see a lot of decay, a lot of destruction, and so we salute you for that. Let me ask you an important question. Do you see some differences based on gender in terms of how persons are responding to the pandemic? Or what's your sense of, for example, women who are homeless? Do they have different challenges during the pandemic than men, or is it just shared experience across the board?
No, this is for the women, they're the most vulnerable. They're becoming prey. So they have become literally prey to these men who are affected by homelessness and mental illness and substance use combined. You know,
Mhm.
they haven't dealt with what's occurring within them, and they're beastly. They beat on pregnant women.
Sure.
They will rob them. They will leave them there for dead. They will charge them to exchange for sex if they're gonna let them stay in their place. You know,
Sure, sure.
they don't really offer genuine help. You know,
Exactly.
but
You're
back in the
absolutely
days when we were going through stuff, you would literally take in a whole family into your home and until they get on their feet. It's not like that no more. It's about either you pay, play, or get out. If you can't, now they're having domestic violence or violence against them, and then they have these charges against them. It's our women.
Yeah, you're very, very accurate. The women present with another layer of vulnerability, and
Absolutely.
they're often they're already victims to circumstance, but they're victimized even more because of their state of vulnerability. And I hear the stories from our female consumers all of the time that, you know, someone offered them the place to stay, and then they were abused and violated as a condition of that stay. And so we appreciate you really um, alerting us to that. You know, moving, what do you call it? Couch surfing. Couch
Yeah,
surfing.
yeah. It's
Explain
called
that.
what they
Explain
call
that.
hidden homelessness.
Yes, right. And so
So
essentially what's happening is the person is sleeping at different places, family, friends.
yeah,
They might stay a couple of days here with Paul, and then another couple of days with Alfonso, and
exactly.
you don't notice their state of homelessness isn't as apparent
Right.
because they're able to get the shower, they're eating a little bit, um, but they know for sure that they are homeless.
Absolutely. And
Yeah.
now guess what? According to the Housing Urban Development, their rule, a person that lives that way is not necessarily homeless.
Okay.
And then if he's an adult, he's not considered homeless at all. All we can do is just provide him the mental health services. But the reality is, I can't even administer a person like that, the VIs for that test because he's literally not homeless.
These definitions are unfortunate, and
Absolutely. And they
yeah,
fall into those
and
federal categories, right?
right, right.
Mhm.
And there's so many forms of homelessness. So when we think of homelessness, most people outside of the work we do, consider in their minds someone who's living on the sidewalk, bags all around you, sleeping on a cot, begging for money. But that's just one form or state of homelessness.
That is just one
There's
form.
Yeah, yeah.
Now, here's the worst part. Let's say you get displaced. I get displaced from our home right now based on something that's catastrophic as the pandemic.
Yeah,
So now I get thrown into that same population on that same level of
right.
homelessness, the way that it is viewed. And so there's no, separating or type for me where when I get thrown in that same pit, I wind up becoming just like
Absolutely.
the population that I'm just now suddenly associating with.
I
And
was
so, how do I get out of that category quickly? And
exactly.
so now we have a flux of clients that come at us with that, like, hey, can I get this done tomorrow?
Yep, yep.
But we got
No,
to
that's
deal with the reality, because now I got somebody sitting in a shelter 20 years before you who's still waiting.
that's
Come
right.
on
Look at
now.
that. Look at that. I was
Yeah.
watching national news last evening, and there was a segment on the storm that's in Texas, and how it's shut down electricity, and people don't have heat and can't get food. And there was this one family that they interviewed that had a fire during the storm.
Hmm.
Instantly, now they're homeless. So they're homeless in the pandemic during a blizzard condition with no resources to undergird and to pull from. And so, like many people who are just kind of struggling in the DMV, many of us are living from check to check. We don't have a big pot of money that, if there's a circumstance like urgent health matter, you lose your job, you lose your house to a fire. Many people don't have an option to just replant themselves into a temporary stable situation. So homelessness can happen to anyone at any time. And you're right. They may not be classified as homeless at that moment by some of these definitions that the entitlements uh, list. What are some of the services? So if someone came to Prestige, and of course, the criteria for admission is you have to have a mental health diagnosis. But once they're enrolled and diagnosed and start receiving services, what housing supports can you offer at that time if they come in homeless?
Well, I'm even glad that you're tapping on that question, okay? Because now we're providing mental health services. Sure, you can go and see the nurse as soon as you walk in after the intake is done. You could get your diagnosis, so on. But now we have to go beyond the service of just mental health. We got to go at this client saying, "Whoa, what's next?" Guess what? We literally got to prepare you for life. Just
Hmm.
like you will prepare your child to be
That's right.
responsible and accountable.
That's
This
right.
is what you do after you get your education. This is what you do once you complete your education. This is how you manage your accounts. This is how you budget money. This is how you become responsible adult in order to sustain or even maintain or even obtain housing. And basically, we are literally, guess what? We are nurturing, even in the state of mental and adulthood, of mental instability and financial instability and no permanent housing. We literally have to nurture children back
Absolutely.
to a reality that they're not really prepared for. I cannot house a person that has dual diagnoses, who has a reoccurrence of substance use and his
Exactly.
disorders, and then put him in a housing unit, because guess what? He is not fully recovered.
Yeah, you're not gonna be able to achieve a good outcome because the other stability factors are unmet.
There
Well,
you have it.
housing is a stability factor. Good mental health is a stability factor. Good physical health is financial literacy is a stability factor. Employment is a stability factor. So what
Always.
I'm hearing you say in your lane of assisting persons who are homeless, the other stability factors have to be addressed simultaneously. And if any of those are unmet, so active substance abuse, then if that's not being managed and treated, then your role and your responsibility has limits to it.
Absolutely.
And so there has to be a lot of teaming between disciplines. There has to be a lot of teaming between specialists.
Yes.
Uh, it sounds like you have to coordinate and collaborate with some of your professional peers to get a holistic approach. Just help them stabilize all of these domains so that they can be successful. Um,
Yes.
yeah, that's,
Absolutely.
and you said something else that's critical, that housing, uh, you know, many of our consumers come into Prestige seeking housing. That's a very common request. However, not all of them are stable enough or functional enough to obtain what they describe or as what they want in housing. So when you talk about skill build, do they even have the skills necessary for independent living? Can they cook? Can they shop? Can they budget? Can they maintain? Can they clean? And so you're so accurate when you talk about these skills that are necessary even to support a placement. A placement is the ultimate goal, but do they have the skill set and the mental stability to maintain the place once you and your team secures it for them?
Now, fantastic question. I'm glad that's how you put it out there, because now we have to peel back the layers to tap into that memory that they had lost. So they've grown so accustomed to what's should be available to them, because now here they want help. They're thinking this should be available to me. Hey, the government puts it out there. So, they have this mindset that, hey, we're going to be taken care of. And they forget those simple get up and brush your teeth type of thing that they're supposed to be doing. They literally put that to the side. So what I do is sustain services when it comes to the housing component. I give them the reality and keep them busy, so that way I could bring them back to the memory that this is the work that you got to put into in order for you to achieve the outcome that you're looking for. Because all I can do is control the pro control the process.
The
But you're
process,
gonna
right?
have to you're gonna have to really dig deep. I mean, if you say you want to stop smoking, you gotta stop smoking. If you don't want to drink coffee, leave it alone.
That's right.
Those are the factors that sets it right off right there, and then it leads into heavier things, whether they realize it or not, whether they admit it or not.
Right,
They
right.
want to say this is what's happening.
Yeah, exactly, exactly.
So
I
that's how I sustain services when it comes to the housing, so that way they could keep coming back. They got to bring documents. They gotta reinvent their lives and mold it back to the way that they want it. And so with that type of service and suggestive services,
and,
it's
and,
gonna
and
keep
and
them.
that in itself, it, it, and that in itself is a process. So again, our consumers are in urgent need of housing, and they
Yes,
want it now.
yes,
But the process doesn't accommodate a now placement. A now placement often is just a shelter option. Uh, but when you talk about transitional housing, single room occupancy, CRFs, there's a process that has to be met uh, before you can even be considered for those placements. And again, with the pandemic as the backdrop, you know, I got to remind the audience that if I'm in a state of homelessness, I probably don't have ID. I probably don't have, so my identity, which I have to confirm to make sure I'm eligible for the entitlements, I can't even confirm it because I don't have it. So
you
now
know,
I got to go get my ID. That's a process because, as you know, DMV has new procedures, or Social Security has new procedures. You can't just walk in without ID and to get ID. And so it can be very uh, daunting of an experience for someone who's going through this process. Let me highlight one more thing before we close. We know that those who suffer with chronic and persistent mental illness primarily includes those with thought disorders like schizophrenia, schizoaffective disorder. We know that the onset generally of the first episode is between age 18 and 23. We know that the literature is clear, professionally,
literature is clear, right?
that's your experience. Now, those are critical, that's a critical developmental stage where you start developing some of the skills that you need to live independently. I mean, that's prime time right there. So if I've disrupted my learning opportunities, a psychotic experience or hospitalizations, then I've never actually acquired the skills of independent living. I've never even begun to develop the skill.
That's
And
right.
so I'm glad you highlighted the fact that housing eligibility has to include functionality. And I'm sure there's instruments and tools that you apply to kind of assess and tease that out. So again, in closing, if someone, what's your process at Prestige? So someone comes in receiving behavioral health services, they're getting med some community support therapy, and they're seeking housing. What are the first three steps they do with you? How
Their
does someone
first,
get referred to you?
yes, their first three steps is to engage their clinical management teams. And so when they engage their clinical management team and they go through the therapy and and they highlight the experience and the narrative is available, it's the way that the housing component literally functions. Because now we're looking not only for the mental health disorders, we're also looking for the physical disorders. So that way we can categorize each individual not only by age,
Sure.
okay, not only by age, also by categories. We have returning citizens, we have substance users, we have domestic violence, we have severe illness,
Right.
HIV. And so,
Here.
are we still there? I
Yeah,
lost.
we're still here. Can you see me, Mr.?
No, I can't see you.
Can you hear me? Brother Alfonso, we were talking about the three steps that generally uh, a person, a client, a consumer follows when they're referred to the housing division within Prestige. So there's a teaming and an assessment by their clinical team first,
Yes.
and then they refer the case to you, and then there's different instruments you apply to assess their functionality, their stability, and their need. Once your assessment is complete and you get these findings, if a person is eligible for some form of housing placement, what's the next step?
Now, someone that's eligible for housing placement,
Hmm.
now that's when all of us collectively get together to prepare that person for graduation,
Okay. Okay.
so to speak. And so, collectively, on a collaborative level, we get them with their inspections, which also takes time. We find, of course, their locations, we get the inspections done, and then from there, it doesn't end because
Right.
now we have to provide or deploy case management. We have to stay on top of them. We got
That's
to
right.
make sure that they learn their tenant rights, that they learn their rights to rent, learn how to cook and clean, learn how to maintain a property. Because here it is, you're getting lucky enough to, well, you got the opportunity to move into a place, but guess what? That landlord, he's leery about you, voucher or no voucher, credit or no credit. A lot of them have bad credit. That has to be repaired. And so all of those things right
Yeah.
there, those are the steps. And
Yeah.
so even when I categorize each of our clients by age and chronic disability and chronic homelessness, I'm looking at the history, I'm looking at their criminal background, I'm looking at all those things. Then that's when I could literally sit there with the other community and then refer them and see if they could get matched to anything. Just
Right.
now recently we were able to and this is really rare that we was able to get a referral to for those that have sex crimes. Those
Right.
are the
Right.
hardest ones to house.
That's right.
Those,
That's right. I
and so
forgot
now we
about that.
have 15 available places for them, and so we're going to put those referrals in with all their histories and the nature of their crimes and send it in hopes to
Very
get a
good.
response.
Oh
And
boy,
so
that's
that's what it all takes. So at once all that falls into place, then it's a waiting game for the housing component and for the rest of the agency and staff members. We just have to wait, and we of course creatively continue to provide mental health services and be creative with the services when it comes.
You're definitely stressing systems, process, teaming, collaboration, steps,
Yes.
procedures, right? And it sounds pretty complicated, I'm sure, for the consumer who's coming out of the streets trying to figure out and navigate all of this stuff. Um, in closing, one thing that really stands out for me is if I'm in a state of homelessness and I have no income, I generally at that moment have no housing options, no permanent stable housing options. Income has to undergird the application. I don't care if it's subsidized housing or straight market, And so I'm sure it can be, again, a very daunting experience, not only for the consumer, but for the worker, because there's so many things that have to be aligned before you can actually get a successful housing application in place. Hey, Alfonso, I know native New Yorker from Brooklyn, and I appreciate just that experience, but I know that Washington, D.C., DMV is unique in terms of resources. I've lived in New York, I lived in Philadelphia,
Mhm.
and I've never been in a city outside of DC that has more resources available and more access. And so, unless you've been lived in other places, you wouldn't recognize that not all cities have even the few options that we have here in the DMV. But what you're suggesting is even now, during this pandemic, those resources are compromised. Um,
Basically, I mean,
Basically, yeah,
it's just a barrier. So now you just can't get to it.
right,
And so
right.
now we have to make ourselves available so that way they can get to it.
That's
And
right.
so that's what makes all of us stand out, here at Prestige, because we're not waiting for our customers to go and get a phone. We actually go and give them a phone. We go and
Right.
get them. Okay. We have a nonprofit organization where we could literally create jobs. We could have transportation service. We could have delivery service. We could have culinary arts created in our nonprofit side of Prestige. We could do so much with what we're doing for this community that I want to come to Prestige to receive services, and I want to know what else is there that I could be provided. We got a peer certification thing that's going on. I promote those things, especially when someone doesn't have income. I need that
Right.
person to get income,
Right.
even if it's Social Security. I'm
Mhm.
not going to give you IDA so you could pay it back. No, I want you to highlight your experience so that way when we get the information, we could compare it to what SSI is looking for. Okay, and when we promote the narrative, they come and look at our stuff. They'll approve of the claims that they're putting in for when it comes to SSI.
That's right.
So we provide them with a benefit specialist, a vocational specialist, and when we're doing all those things, it's an attraction. They're gonna come, and however
Absolutely.
long it's gonna take them, they're going to forget they're homeless, but because they're putting in the work, they're going to be
Yes.
okay and patient right now to the way that they're living because they're doing something about it. And so long as that we remain consistent and supporting them to make that happen, it's
Right.
done.
Right.
We're
Mr.
going to
Padron,
make a name for ourselves, right?
yeah, Mr. Padron, you're a coach, you're a facilitator, you're a mentor, you're a social scientist. You have to play so many different roles
Yes,
to help our consumers navigate all of these systems and all the barriers that
that's
that
right.
that that, that they're presented with. Alfonso Padron, Senior Housing Coordinator, Prestige, we appreciate and salute you for your service. You have
Very much.
really enlightened the audience on some of the barriers and the realities right now during the pandemic around homelessness and service provision. We thank you again for your service. You're at the front. Talk about front line. You're beyond the front line. You're in it. You're in the trenches,
There you
helping
go.
people recover and get a sense of stability. For the audience, I know you've appreciated the time with Mr. Brother Alfonso. And Alfonso, if people wanted to reach out to you directly, what would be the best contact information? Where can they find you?
I give everyone my personal phone number. It's
Come on,
240-701-5112. You can
repeat
call
it
me
one more
anytime,
time.
every time. That's right. Call me every time, anytime, as many times as you want to. I will not answer that phone, but I will get back to you.
Gotcha, gotcha.
Yeah,
What's that number again?
it's 240-701-5112.
And do you mind sharing your email address with the audience? Do you know?
Work email is it
Yes,
should be work, right? So
yes.
it's Al Padron at pbhdc.com.
All right. Thank you so much, Padron. Listen, for the audience, if you want more information about who we are and what we do at Prestige, visit our website at prestigecommunityresources.org. Thank you for joining us today. This episode has been significant and impactful. It has been a pleasure having Brother Alfonso and the audience with us today. Until next time, stay safe and be well.